Hello and welcome to One Man Think Tank. Today I'm going a lot more improv than I normally do. As you can see, I've pulled up the ultimate medium of communication, MS Paint. And that's for a very simple reason. I wanted to make this little video, as you can see from the title. I'm going to be talking about why we in the US need a national health service. But there's been some big news about the coronavirus thing today. The WHO calls it a pandemic, World Health Organization, and also projections of global infected went up from about 20% to between 40 and 60%. Mortality has not increased, except in Italy, and overall we have no idea how many people have practically been infected worldwide. The only nation who seems to put a proper quarantine on this thing is China, and the question is how long till someone else infects them. Now we're going to do a little bit of math here, first off, so to explain why the infection rate is so dangerous, then we'll get to this, because here's where our big factor comes in. So, the United States population, oh, blimey, I'll put it this, is currently rounded up ever so slightly around 333,000 million people. Forgive me, also 1115. I want to explain, I wanted to get this video out, given all the big news going around with the coronavirus, as most of the colleges and school systems seem to be going to remote classes or just flat canceling. But, so I want to get this video out while the news is still hot. But the US population currently, I'll round up a little bit, is 333 million people. If we assume 60% of this, 60% of the US population is going to, well, let's actually start off with the lower level. If we assume that 40% of the US population is going to be infected, then that means approximately 133,000 million, I keep saying 1,000, million people will be infected. But the high end of that is roughly, I hate doing mental math sometimes, is roughly 200,000. Actually, no, that'd be 66%. So 60% would be 200 million. This is the likely infected range. We'll get back to that in a moment. However, only 1% will, well, they say 3%, but in practice it's probably going to end up being around 1% or lower, will be killed. So we're going to lower our little bar here. So 1%, or 3% of 133 million is 3,990,000 people. The high end of that being 6 million. The high end would be, like I said, you'll have to forgive me, I'm tired, would be 6 million people. So if 3% is in fact the mortality rate, we could be looking at an upside of 6 million deaths in the country, which is considered bad. That would be just about 2% of the population. Now, more realistically, because we'll have to assume unreported illnesses and the whole lot of things, we'll most likely see a range of about 1,033,000 deaths, and 2 million, which are still really big numbers. Those are people's lives. But here is where we run into our fun little problem. Because one, we're looking at gross mortality numbers. These are massive amounts of people who could die from this, and that in and of itself is a tragedy. But also, what we're witnessing is the overstimulation of our healthcare system. We do not have the hospital beds to handle this, and we already can see the grim future of what's ahead in Italy if we don't handle this properly. Where they have to pick and choose who they're treating, where those Obamacare death panels, remember those? They prop up anytime anyone wants to talk about universal health care, are actually happening. This is bad. In general. You don't want to force anyone to make those decisions, but also you don't want to put anyone in the position where they have to be turned away from care from a potentially fatal disease. 6 million is not a number you want to be part of. Now, the hospital beds, the reason I keep bringing them up is this is what Medicare for All in and of itself would not solve this problem. Medicare for All is, it's a single-payer insurance system. And an insurance system is really good at making sure that when people go in for care, they're not charged. So this would allow everyone who needs to be tested to get tested. This would be a case where we could... So, this is, well, I'm feeling ill, I'm going to go see my doctor. I don't need to worry about being charged an arm and a leg, high hospital fees, whatever. That is not actually the problem. It's a problem, but it's not the big problem that makes a coronavirus pandemic so dangerous. It's the number of hospital beds available and people actually being able to receive treatment. Because you see in the US, our hospital system is heavily decentralized, but it can basically be described as such. You have for-profit hospitals, which will be the blue circle. You have non-for-profit hospitals, which are the red circle, and you have public hospitals, which is the green circle. I'll have them overlap a little bit. Now, on its own, you've got 3 spheres with very little overlap between each other. But it gets worse because in the public sphere, because in all of these spheres, you then have different groups of them. No state, as far as I'm aware, has a national health service of any kind, usually based on regions or cities. The same thing goes for nonprofits. There are no major nonprofit hospital networks. So you end up with a bunch of cookie-cutter systems inside of the systems. And you're left with these orbs filled with orbs. They do not overlap anyway, and there's no real way to kind of centralize control or handle the issue. The government can't really step in to force anyone to do anything because we don't have a methodology for this. When it comes to healthcare, the assumption has always been, well, if you can't afford it, go accept your fate, get in the nearest river. But in the 21st century, that has been frowned upon. I'm pretty sure it was frowned upon back then, but now we actually have the knowledge the socialized healthcare systems work. So the issue we face is 1. Let's put up a little tally of our issues. 1. Not enough hospital beds. Let's move this over here. Issue 1. Not enough beds. Issue 2. No central control. And issue 3, varying I'm not sure if I'm spelling that right. varying quality of control. That's the third issue here. Hospitals in the same sphere aren't likely to be of the same quality. Well, I will say state-run hospitals and federally run hospitals, which I'll refer to them all as state-run from now on, unless I'm specifically making a point, have a general quality level of good to great. Non-profits have a general quality level of okay to great, and for-profits typically run the gambit from bad to good. There's one or two great ones, but I'm not going to generalize that heavily. So, the first issue, not enough beds, can be solved by having central control, but we don't have central control. So we can't, because we don't know how to handle the pandemic, we don't have enough beds. And that leads us back to issue 3, where if there were enough beds, we're not even sure if everyone would get the quality of healthcare we need. And we are assuming, in this case, we have Medicare for all. So how do we solve this problem? Well, first we need to simplify this by creating a centrally controlled system. Now, right now, the biggest proposal that's been put forward, and it was in the original Medicare for All bill by John Conyers, H.R. 676, which has since been replaced by the Medicare for All Act that Senator Sanders created in the House's version. It had a ban on for-profit hospitals. This is the bare minimum we need to do. So step 1 to fixing this is just removing for-profit hospitals and requiring them to either become state-owned or non-profit. That is step 1. Already we've simplified, well, it's not really completely eliminated the issue. This has basically solved our biggest concern. People not receiving good quality treatment. Okay, good to great is the range we want here. So eliminating for-profit hospitals essentially covers that for our sake. Next, we need to handle central control. This simply means we need to simplify our system, and that means, in my opinion, not banning non-for-profit hospitals, but completely rethinking our state-run hospital systems. And the way to do that is by creating our own National Health Service, a variation of what they have in the United Kingdom, the only nation with a truly nationalized hospital system. And in this case, what we'd do is we'd have the federal government, who will be represented by this sphere. They will have federally run hospitals. It's like the federal prison. So we're going to base this off prisons here. The federal government will have its own federally run hospital system. They already run certain federal hospitals. The best example being the VA. So they will have certain federal hospitals that they will run. But for the most part, what they will do is they will provide funding to the states. This funding will be completely conditional on they take all of their state hospitals and they make their own state-level national health services. So if you live in... Now, all it will say is it goes to funding your service. So in a state like California, it could be they've got a regional system, so you've got a North California system, a Central California, and a South California, while in smaller states like Massachusetts, New Hampshire, the New England states, they could do a combined system. This solves our central control problem. Now we have technically 50, we have 50, basically, different systems that also have a central regulatory authority. So they can tie funding to doing certain things. This is what's called a funded mandate. So let's say, hypothetically, there's a coronavirus outbreak. Congress could pass a bill saying, okay, we're giving the U.S. National Health Service an additional funding of $50 billion. I don't know how much would be needed in this case. We'll say $500 billion. They liquidate everything they can find. $500 billion out of nowhere. No one cares about the deficit. $500 billion, And you will distribute this to the states to construct more hospital beds. Then, working with each of the state governments, they'll be able to figure out how many beds there are. So by creating central control, we solve the problem of not enough beds. This will allow us to properly treat the coronavirus, because that is our issue right now at the core of it. If we had Medicare for all, that wouldn't solve our coronavirus issue. In fact, arguably, it would make the situation worse, because you're just increasing the number of people going into the system while not fixing how they get their beds and such. In fact, arguably, there's an argument to be made, even without Medicare for all, if we created a national health service, that would solve our problems better than Medicare for all. That would solve more problems than if we adopted Medicare for all tomorrow. That's really all I have to say. If you want to stop the coronavirus problem, a national health service is the way to go. I'm going to make a more in-depth video now with 5 reforms I think need to be taken out to properly handle this epidemic. As a spoiler for those of you watching this, it's going to involve paid sick leave, Medicare for all, national health service, drug production, nationalized drug production, and nationalizing the airlines. I'll go into my full thoughts in that video once it's done. Otherwise, if you like the video, please like and leave a comment down below if you have an opinion or any questions. I imagine this video theoretically could be a little bit confusing given the fact it is totally unscripted and based on MS Paint. So, sorry about that one. But also, if you like the content of this video, want more policy, I'm also posting election punditry. Feel free to subscribe and click the notification bell, which will allow you to see when I put out a new video. Otherwise, as always, have a wonderful day and, well, keep safe out there.